provincial court decision, and the factum that I wrote was so strong that the Department of Justice conceded and decided to not only admit that I could get a retrial, but that they didn't want the retrial and dropped it all, so that there's no actual decision either by the Court of Appeal or another judge. And so the regulations, the marijuana medical access regulations, allow people to grow and use cannabis, but only technically dried cannabis according to them. If you make an extract, then you are not protected by those regulations. And so what that means is if a person produces what's called technically cannabis resin, which could be hashish, or a cookie where they've strained out the leaf using a cheesecloth, then they've actually made resin or a cannabis extract. I've been convicted of trafficking THC in a cookie giveaway, which is ironic because the THC is the active ingredient, there's primary active medical ingredient in cannabis, not the only one that's important by far. And so to, on one hand, have the plant legal with all the tars and other things that aren't as medically beneficial as, say, the THC or the actual resin. So when it's concentrated, you actually use less and get out the impurities, and for some people it's much more medically beneficial. And those laws concerning cannabis resin are in fact punishable under the Controlled Drugs and Substances Act substantially more than for cannabis marijuana. And so it's really ironic and hypocritical in so many ways for Health Canada to legalize and in essence support the smoking of cannabis as medicine, and then criminalize making a cookie or other edible or skin product from it. And because of this Achilles heel of Health Canada's programs, there's really very little incentive for the police and Crown prosecutors here to put hundreds of hours and thousands of dollars into a court case when they're very aware that Health Canada's problems are not hard to fix. In fact, as Owen said, we have a letter here from the City of Victoria back, it was 2006, so it was a few years ago, but essentially Health Canada's programs have not changed. And the Mayor and City Council condemned Health Canada's programs and the MMAR as being inadequate and forcing people, in essence, to go to the black market to get proper health care. And while it's not a business license, it is support from the city in many ways for our programs. And so our strategy now that there is no court and we are able to go to the courts for resolution is to again go back to the city, as we've done many times. I also have our annual proclamation for International Medical Marijuana Day that they signed. So we've been working with City Council for a very long time, and we will be going to them again here. And what we are hoping to do is to get the city to write a similar letter to this to Health Canada, requesting that we get an Exemption 56 from the Controlled Drugs and Substances Act. It's a similar exemption to what Insight has in Vancouver. In fact, the BC Court of Appeal just today ruled in favor of a lower court decision that kept Insight going. And in fact, if you read the court decision, a lot of the medical marijuana case law was used to support giving an exemption to the CDSA to allow for research into harm reduction and other strategies. And that's what we want. We want this to be a research project. We want to have an Exemption 56 from the government so that we can study what these cookies do and how they affect people and how they should be made. Because we think we've done it properly, but maybe there's a slightly better way. But there's no research being done. The Canadian government has gutted all research being done on cannabis, with one exception. They're actually doing a study on whether cannabis can induce schizophrenia in the youth. And so, in contrast to studying the health care of Canadian citizens with even their own program, because they're selling cannabis to people, they're letting them grow their own under completely unregulated circumstances. And it's not only inadequate, but it's putting people's health care at risk. And in some ways, with their programs, it's putting the general community at risk, because instead of licensing professionals like Owen and myself, they would rather have every single Canadian that needs medical marijuana either growing it themselves or have someone else growing. Maybe a designated grower with 2 or 3 people at most in one location. But if there's 1 million Canadians that need this medicine, that would have 300,000, 400,000 grow-ops across Canada. They don't tell people how they should be growing it. They don't do anything to support people in providing their own medicine financially or otherwise. They just give people a license and say go. The programs that they have are not only inadequate, but again, they're putting people's health care at risk. And they should be giving exemptions to organizations like ours and licensing us just like the Liquor Control Board essentially licenses, their various establishments.
So what are you going to do? Like, it's sort of hanging over your head. Like you say, you fulfilled your obligation, but they haven't actually dropped the charges. That whole question of the conversion of marijuana to another product, that question is still hanging out there. How vulnerable are you, and what's your plan? Have you resumed baking?
Oh, we're still baking. Oh yeah, we haven't slowed down, although it's not in a very good location. And we're going to move into probably a house now, because we can't get a commercial space really as quickly as we would like to. So it's not the ideal, but the apartment we're in right now is under much different circumstances than we were before. And so we're going to find a bigger location, but again, we need a commercial space. So it's something that, on the supply end, we're able to manage. What we really need to do is to start, taking the science to a new level.
Sorry, how long did it take to find the current location, and what impact did that have on your clients? I know there was a lot of concern that you wouldn't be able to find somewhere to resume baking right away.
Well, I had a lot of offers come in for people's private residence to be used, so it was just a matter of picking the best home. Now, we were already outgrowing the apartment we were in, though. It was 7 days a week, and it is again now, so the person who's in the home doesn't eat there anymore. So it's very inconvenient where it is right now. But the people there have been very gracious to let us take over, in essence. But it won't be able to last for very long. So we were able to, secure a place relatively quickly. But yeah, we've had a lot of people go without medicine for a day or two, and people losing sleep and being in great